Hey guys, welcome to the first episode of The Breakdown. First off, I just want to start off by thanking Amboss. I've actually got permission to record myself taking these questions, so please don't send me an email that I'm have like copyright infringement or any of that. I do have permission to record these questions, and it's amazing that they're letting us do that. So how this is going to work is each week we're going to try and focus on one key principle of test taking skill. So this first week it's just going to be, how do I even approach a question? So where do my eyes go first? What should I do second? How can I figure out where to start this thing? Next week we're going to work on highlighting, and then I'll go into a lot more on that next week. The following week it's going to be on summarizing. So figuring out one liners for what is this question actually asking me. And after that, we're going to work on process of elimination. So how can I use my own knowledge to kind of get to that right answer? And then lastly, the last one is just going to be in a big thing that I've seen that a lot of students don't do is the why. So why do I get questions wrong? Was it a knowledge gap? Did I just not know? Did I make a silly mistake? Or did I just miss something in highlighting? So was it my own personal test taking skill that didn't lead me to the right answer? And I see that quite a bit, that people just don't take the time to figure out why they got something wrong, and then it makes it harder to learn that later on because you've never actually pinpointed what the mistake was and how to correct it. So this week we're just going to focus on how to initially tackle a question. So let's get to it. I have 3 questions here today. I'm not sure I'm going to do all of them, but we'll see how much time this takes. So the first thing I always do when I see any question is I read the last sentence first. Now, there's a huge advantage to that. For me, if I get a farm question and it's just what is the mechanism of action of this drug, and the drug is one sentence above that last sentence, I am not reading the whole stem. I am looking for the drug and I'm looking for the answer. So right there, I've saved myself probably a good minute that I can use on questions later on. So say I get a question 10 down and it's all up down arrows, those take quite a bit more time. So any question, farm specifically is a really good one for this, but any question where I can save time, I definitely want to do that. So let's start off here. So for me, when I'm highlighting, and again, we're going to go into more of this in the coming weeks, for me, this last sentence, I just want to get, the gist of it. I'm not highlighting the whole thing because then again, it defeats the purpose. So what is the cause of her current condition? That's what this is asking me, and that's what I want to highlight. So the next thing I do is I look at all the answer options. So I'm just kind of getting a general idea of like, this is some kind of MSK question. That's all I need. I don't need to pinpoint like exactly what type of question this is. Just a broad category helps me kind of figure out what the heck I'm going to be reading about. So I guess second thing, and again, I keep saying this, but I'm not going to go into a ton of highlighting, but I always highlight the sex and the age. Certain things are just more prevalent in men than they are in women, and vice versa. Certain things are way more prevalent in different age groups. So just get used to always highlighting that. Back, so shooting pain, left lower back. I mean, first thing that comes to mind to me is, did they lift something? Did they fall? Did they hurt themselves? So things are always just kind of circling in my mind as I'm reading this thing. Pain that radiates down both legs. Maybe I'm thinking sciatica right now. Okay, so she lifted, or he lifted something heavy. Now I'm thinking slip disc. Okay, this sentence right here. The passive raising of either of the right or left leg beyond 30 degrees triggers a shooting pain. So this is called the straight leg test. And what this tells me is this patient has a slip disc, essentially. So now I know that, whatever I'm looking for, this has to explain a slipped disc. So right off the bat, I know personally that I can go here because, we have a herniation. So this is our slip disc. So that disc is actually, herniating out, pushing on the nerves, which is why we have the shooting pain, sensory loss, and muscle weakness as well. So if I do get an answer like this, say, and I know it just right off the bat, if this was step, yes, I'm going to click it. Yes, I'm going to move on. You know, for our purposes here, and when you do this at home, you can mark the answer right away, but please make sure you're going through and figuring out these other ones. So A, involuntary contraction of paraspinal muscles. To me, that just sounds like a muscle spasm. So that would be in someone who just has a strain, you know, not someone who actually has disc herniation. So we wouldn't be seeing sensory loss with that. Inflammatory degeneration of the spine. I mean, that sounds a lot like osteoarthritis of the spine. It could be something maybe like the ankylosing, how do you say that? Here we go. Ankylosing spondylitis. That's a mouthful. But basically, the spine gets fused in that sense. And then let's see what else they say. Degenerative osteoarthritis, psoriatic arthritis. Okay, so arthritis, basically. Compromised integrity of vertebral body. To me, that screams osteoporosis. So I'm thinking like a compression fracture right there. Inflammatory reaction in the epidural space. Maybe that's cancer. Inflammatory reaction in the epidural space. Yeah, my best guess is that's cancer. But again, you know, you don't have to know what everything is all the time. You know, and half the time, if you can get it to 2, most of the time you're going to get to that right answer. You know, for us, we already knew this was a disc herniation. That's all I'm looking for. But, you know, in the sense of learning material all around and getting a better grasp on your knowledge and applying, you know, new information, it's best to answer all of these, because now we've done, you know, 4 questions in one instead of just one question and boom to the next one. So for learning purposes, please just keep trying to, you know, learn everything, learn as much as you can, because, you know, when test day comes, you might be surprised that they make a question and it's actually, the answer is going to be, you know, inflammatory reaction in the epidural space. And because you just went through A through E, now you've gotten that question right. So let's just see what they say here. So this is an abscess or bone metastasis. Okay. All right. Let's check this next one out. So again, I'm looking for the cause of the renal injury here. A lot of times you'll find, you know, a question has multiple things in it, and the answer options are multiple things. Make sure you're answering the question they are actually asking you. That's why highlighting is so important. And again, I kind of seen this here. So this is some kind of toxicity. Yeah, basically just, you know, like a hypersensitivity transplant rejection question, maybe. So 4 months ago, this person had a renal transplant. They're on these medications. I do try to highlight the medications. If I find I don't need them later, all you have to do is just click and it's gone. So it really doesn't take that much time to highlight them and decide later if you need that. So creatinine concentration 2.7. I mean, when I see stuff like that, I'm just thinking, okay, this person had a renal transplant. Now their kidney's failing. So the new one has gone bad. Anything above 1.2, 1.3, you're getting into loss of renal function. So they did a kidney allograft biopsy, tubular vacuolization. Oh boy. Okay, this is definitely a really tough question. So how I approach these things, you know, is which ones do I know I can get rid of first? I know I can get rid of this because they would need to tell me something else about like IgG. This person would need to be taking an NSAID, you know, one of those medications like a beta lactamase, something that I know causes interstitial nephritis. We don't have any of that here. We just have, you know, immunosuppressants, and all of them are immunosuppressants. So, and then a steroid. So preformed antibody mediated rejection. whenever I see preformed antibody mediated, I mean, anything preformed is quick. So we're already at 4 months. So in my mind, I can get rid of this right away because this to me screams like hyperacute transplant rejection. And in that case, I'd be looking for some kind of thrombus or clot, something, immediate. And I don't see that here. Prednisone, I know, does not cause nephrotoxicity because it's actually one of the treatments for lupus nephritis. So why would they do that? Sirolimus toxicity. So there's a little thing to remember with the name. The SIR is actually saves the kidney, and it's also the I is for insulin resistance. And then it's pancytopenia. So they get pancytopenia. So that's how I remember the SIR. So this one, oops, this one is out. All right, these two are what I'm left with. T cell mediated rejection. So I'm thinking this is, it's like an acute rejection. It could be chronic. T cell mediated, I think that's acute. Let me come back here for a second. So I have a physical exam that shows no abnormalities. When I'm thinking like later transplant rejection, so like acute, chronic, I feel like they have to have a fever because you're getting into that realm of, donor MHCs reacting with T cells or T cells reacting with something, and you're going to get, interleukins, cytokines. I should have a fever or some other symptom besides just, they did a biopsy and we have the vacuolization. So I'm leaning more toward tacrolimus because I do think that's nephrotoxic. Boom. Yes, so that's right. So tacrolimus is a calcineurin inhibitor, nephrotoxicity. We have our vacuolization. In addition, we can see some scarring in the glomerulus. Okay. So let's just read on this one quick. So T cell mediated rejection, that is an acute rejection. So we're looking to like weeks up to 6 months. T cells reacting with foreign donor HLA antigens. HLA antigens is a fancy word for saying MHC. So like your MHC1, MHC2, which reacts with CD4, CD8. They are most often, it is mostly asymptomatic. We're going to get decreased renal function, so that's kind of confusing because we did see that. However, biopsy shows tubular atrophy. Okay. So just the biopsy alone could have led us to this, but again, maybe we would see a fever, maybe we didn't. So, in my mind, like I said, again, if this was, week 5, what I would be doing to myself right now is, I didn't know this question, right? My process of elimination did work, but probably for the wrong reasons. So I would make a note of this. This is a knowledge gap. So this is something I need to go back to first aid, something I need to make a flashcard on, something that I need to do to learn this material better, instead of hoping that next time I get a question like this, I can get it right just by kind of half-assing it. That's not how you want to approach these things. Yes, I got it right, but I got it right for the wrong reason. So I definitely want to take time and figure out this material, so I want to go back to immunology. I want to go back to this farm, look at those transplant rejections, take 15 to 20 minutes and do that, because next time the question you might not be so lucky in your guess, right? All right, next one. So we're on our last question here. So I'm looking for a mechanism that's directly involved in this patient's valvular condition. So obviously I know this is a heart problem. So this is cardio question. 51-year-old man. Okay. Recurrent dental abscess. This just tells me he's prone to infections. High fever. He's got something going on. He's got a new murmur. Okay. Radiates to the axilla. Anything that radiates to the axilla mitral. Linear reddish brown lesions underneath the nail beds. Okay, I think they're describing those things in endocarditis, not the James Way nodules, but splinter hemorrhages. Okay. So this right here, this is our Janeway nodule. So they're telling us somebody has endocarditis. Okay, blah, blah, blah. So what is the mechanism of, how you get endocarditis, and why is this person having mitral regurg? Yep. Okay. Myxomatous degeneration. That is like Marfan's, I believe. Antibody cross reaction. That's again hypersensitivity stuff. Sterile platelet thrombi. This is what people with lupus get. Calcification and fibrosis. I'm going to leave that for now. Coagulative necrosis. No. Coagulative necrosis, you have to have, some kind of clot somewhere, like ischemic issues. So that's not the process for what they're asking us now, right? Fibrin clot formation. Okay. So I think this, maybe they're trying to trick me, maybe not, but calcification and fibrosis, I'm thinking, old people, like really old, like in the 80s, because most people are going to have calcification, most likely of the aorta, but can happen in the mitral. But that is not the cause for endocarditis. Endocarditis, you get destruction of like the end of the lining of the valve. So those endothelial cells, right? And then what happens is we get fibrin, we get like a nidus for bacteria. So platelets, fibrin, bacteria clump together and they stick on the valve. And then it just kind of stuck and stays like that. And that's how we would get our regurg. Yeah, so first we get our damage, followed by platelets, fibrin, blah, blah, blah. Okay. And then they all stick together and they give us our regurgitation. So overall, we did all that, 3 questions, 10-minute session, not too bad. Next week will be the session on highlighting. So we're going to do anywhere from 3 to 5 questions. I'm going to try to do every time. Most likely it'll be 3, but we're going to focus on highlighting and how to eliminate kind of excess highlighting. So, if we go back and we look at number 1 here, oh, I took it away. Well, never mind. But one good thing about Amboss is it shows me what I should have highlighted. So if you're getting multiple questions wrong, or any question wrong for that matter, you can see, you're highlighting. So when I click, when I actually click the answer option and my highlighting stays up here, I can kind of compare. Did I highlight the right material? Did I miss things that I should have? And that also helps with that why am I getting things wrong? Was this my own test taking skill? Was it knowledge? Blah, blah, blah. So, all right, that's the first episode. See you guys next week. They're always going to be on Thursdays. I'm going to try and upload them before 7 p.m., but I am in internal medicine right now. So my schedule, I'm usually done pretty early, but it just depends on everything else I got going on right now. So see you next week.